My name is Dr. Jacob Choi. Here at FastMD, I specialize in interventional injection therapy. Today we're going to talk about cervical and lumbar epidural injections.
What is an epidural steroid injection?
An epidural injection is an injection-based therapy that is utilized for radicular pain, usually caused by a disc herniation or overgrowth of the facet joints that cause stenosis in the spine.
What can I expect on the day of my procedure?
An epidural injection is an office-based procedure that we provide here at FastMD. During an epidural injection, you'll be brought into the room, placed on a table. We numb up the skin and soft tissues. We'll utilize X-ray guidance so that we can place a needle close to where the disc, the nerve, and the stenosis is located. We utilize a steroid to improve the symptoms by decreasing the inflammation in the spine. After the injection is completed, we'll utilize Band-Aids over the injection site.
What are the potential side effects?
Towards the end of the procedure, you can experience an increase in your normal discomfort of radiculopathy. This will help us localize if this is where your pain's coming from. After the following 2 weeks, when you return with your pain diary, we can determine if a second injection is necessary or if this is enough to control your symptoms.
How can I prepare for my procedure?
Prior to the injection, in the office, we'll go over the list of your medications and any past medical history and inform you if any of these need to be stopped and restarted prior or after the injection.
When can I get back to my normal routine?
Post-procedure, we recommend that you take the rest of the day off and rest. The following day, you could get back to your normal activities as tolerated. If you'd like to know more about our procedures here at FastMD, please give our office a call or see us on the web at fastmd.com.